Our last mini lecture on the behavioral or social learning approach is going to talk about how can we use this to actually change our behavior, and then a quick critique of the approach. So behavior modification is the general idea that if you don't like something about your personality, you can change it using classical or operant conditioning or even potentially social learning. So the idea from this approach is that we can use specific techniques to change our personality. So in order to do that, you have to first observe your own behaviors and identify what do you like about your personality and what do you not like about your personality. So imagine that you have a client who's overly aggressive. We can identify specific behaviors that are aggressive or not aggressive and try to identify, okay, are you aggressive only in certain places, only towards certain people, only if you've had a certain environmental trigger that happened right before this. So try to identify the specific aspects of their behaviors and then try to identify what can we do to the environment to change that, either the things that come before it or the things that come after it. So we're going to identify 3 specific techniques that are often used in therapy settings, but have been applied to this approach from personality because they are designed to change your personality or your behaviors. The first one is exposure therapy to feared stimuli. So basically, if you have a phobia, let's say that you are really socially anxious and you don't like talking to new people, and it makes you uncomfortable to be in like networking situations, you don't like public speaking, we could try to reduce that behavioral tendency to be afraid of talking to other people through exposure therapy. There are 2 specific techniques within exposure therapy, and they kind of have opposite approaches. Systematic desensitization is the idea that we want to retrain you to associate those contexts with feeling relaxed and calm. So we're going to kind of make the previous association of, let's say it's public speaking, and you're afraid of public speaking, we want you now to associate public speaking with feelings of relaxation and confidence. So how will we do that? Systematic desensitization has a client first feel relaxed and confident. So you're sitting in a really comfortable chair, you're listening to Enya, you've got scented candles, you're feeling all relaxed and comfortable. And then the idea is that there will be slow, progressive exposure to the thing you're scared of. So the first thing that you have to do after you're feeling relaxed is there will be a stranger who walks into the room and you have to just say hi. That's all. You don't even have to have a conversation. All you do is you say hi. Okay, great. When you feel comfortable doing that, now a stranger will come into the room and you have to ask them a personal question like, how do you feel today, right? And then once you feel comfortable doing that, you have to have a whole conversation. Then once you feel comfortable doing that, 3 people will walk into the room and you have to have a conversation with all 3 of them. And then you have to go to a party and talk to 10 strangers, right? So it's slow progression, but it's the idea of classical conditioning pairing what used to be something that you were afraid of to feeling calm and relaxed. A technique that's still based on this kind of classical and operant conditioning, but has a different approach is called flooding. And this is the idea that we take the thing that you're scared of and we make you kind of jump right into the deep end and do the scariest possible thing that you can think of. So if you're absolutely afraid of talking to strangers and like going to a networking party type of event, we make you do that, and we know that one of those people in the room is thinking about hiring you for a job, right? So it's super scary. You don't even know which person it is. But the idea is that you've probably built up all of these possible consequences in your mind, like what if I say something stupid? What if I embarrass myself? And so you have all these behavioral contingencies in your head, and that's why you're afraid. If we just make you do it, the idea is that you'll realize, oh, the consequences I had imagined really weren't realistic. And so you'll realize I shouldn't be as afraid of this because I was only thinking about the negative consequences. I forgot about the positive consequences. What are the rewards of me doing this? And so the idea is if you confront this super scary thing, then you'll realize it wasn't that scary and your fear will go away. So we can apply this to any kind of personality trait that you want to change, and we can either slowly, progressively build you up, or just say, you know, just go for it and confront your fear. And the idea is that either way, you should realize my environment is not really going to give me the consequences I feared. I should focus on the rewards and not the punishments. Another idea is called a token economy. And you can see I have a little drawing of an alien here. Okay, so I'll explain what that is in a minute. A token economy is the idea that you want to shape people's behavior by giving them explicit rewards when they do something well or positively, and you're not really worried about punishment of negative behaviors, but you're going to ignore negative behaviors and hope that they go away. So it's really all about the rewards now. This is usually done with children because they explicitly respond to this kind of reward. And it's called a token economy because every time the child does something positive, you give them what's called a token. It could be like a poker chip or a gold star as an example. And when they build up enough of these tokens, they can exchange them for a reward that's something that they want. So if you get 10 gold stars, you get to go to recess, or you get double dessert, or you get to play on your computer for an extra hour, whatever it is. So it's not the tokens that they care about getting, it's that the tokens represent a reward that they're slowly earning. The reason I have a drawing of an alien on here is because when I was in graduate school for 2 years, I worked at a mental hospital. It was a child unit, and we used a token economy on the child unit. Most of the kids there had behavioral disorders, so they were defiant or aggressive, and they didn't do things like have polite manners while they were eating. They didn't treat each other with respect. So we had a system of paper aliens called Zorks. So the name of the alien is a Zork. And the idea is every time the child would do something positive, like be respectful to another child or use polite table manners during dinner, we would give them a Zork. And then they could collect the Zorks, and at the end of the week, we would open the store, which is really a closet in the mental hospital, and there were toys that we had bought there from the dollar store, and they could turn in their Zorks for the toys. And the toys were different amounts of Zorks. So you can get a teddy bear for 20 Zorks, or you can get a piece of candy for 1 Zork, right? The problem with the token economy is that you're teaching kids to do the behaviors because they're going to get an explicit reward. You're not teaching them to do the behavior just because it's the right thing to do. So we encountered a problem where I might run out of Zorks on my shift, and then the kids had no motivation to act positively because they knew they weren't going to get a Zork. So you've changed their motivation from intrinsic, meaning I should do this just because it's the right thing to do, to an extrinsic motivation. I'm doing this explicitly for the reward. So this is a common problem with the token economy is you want to get them to do it for the reward kind of at first, but then slowly you want to kind of scale back so that they're doing it just because it's the thing that they should do anyway, basically. We also, by the way, had another problem in the mental hospital, which was that kids would beat up other kids and steal their Zorks. So we eventually had to end the Zork program, but it's an example of a token economy. The last specific idea that we can get here from operant conditioning is sometimes in therapy, your counselor might suggest something called a contract, which is basically a written reward and punishment schedule for your behavior. So let's say that you're trying to stop smoking. So you give your therapist $100 and they kind of hold it for you. And you set a goal and you say, I'm not going to smoke any cigarettes for a week. So then you go back the next week and your therapist says, okay, did you smoke? And if you avoided smoking, which was your goal, you get a reward, which is that the $100 will go to a charity of your choice. And if you did smoke, then you get a punishment, which in my example here is that the $100 goes to the Ku Klux Klan, which I assume would be a horrible punishment for anyone. So the idea is that that should really motivate you to meet your goal because you really care about these rewards and punishments. Okay, so let's end this perspective with a critique. A lot of people like the behaviorist perspective because the focus on observable behavior is really great for doing research projects. It's easy to operationalize our variables. It's easy to think about classical and operant conditioning as affecting our behaviors. So a lot of people like it for that reason. It's a very scientific approach. The end of this mini lecture also is another reason that people like it. You can use these classical and operant conditioning ideas to change people's specific behaviors in therapy settings, which we sometimes don't think of as actually changing someone's personality. But according to this perspective, that is still their personality. Our personality is simply what are our behaviors, right? So we really are changing personality according to this perspective. A criticism of this perspective is that classical and operant conditioning assume that we're all going to respond the same way to our environment. So the idea is all of the little kids in the Bandura study wanted the pop and candy. None of them wanted to be spanked, right? It assumes that we're all the same, that we're all going to respond to the environment in the same way. And that's really kind of going away from the entire idea of personality, which is about individual differences. So what if one child in the Bandura study is motivated by the pop and candy and another child is not motivated by pop and candy? We didn't make any assumptions about individual differences within the groups. So it ignores the fact that you might respond differently to the environment compared to the person standing right next to you. Okay, let me know if you have any questions about this one, and good luck on the quiz as always.